Governor Leavitt, Secretary Leavitt, welcome to our hearing today and thank you for coming. The purpose of the hearing today is to discuss the President's budget request for the department over which you are the Chief Executive, Department of Health and Human Services, and to give our committee members the opportunity to delve into the President's proposal in more depth and detail. I extend a warm welcome to you. We appreciate your coming, and we look forward to your testimony. There are some significant cuts or cost reductions in the budget that has been sent to us. Medicare would experience a cut over 10 years, cost reduction, call it what you will, of $252 billion. Medicaid, at least $29 billion over the same 10-year period of time. CHIPS, Children's Health Insurance Program, a program in effect since 1997, would be increased, but not enough by our calculation to cover the existing beneficiary population of around 4.5 million children. We're concerned that fewer children would actually be covered under the funding proposal that the administration has put forth. So we have some significant questions to discuss with you today. The President's budget has to be viewed in a larger context. We note with some dismay that these cuts have been made, $252 billion in Medicare, $28 to $29 billion in Medicaid, and yet this money has not been, the savings, to the extent there are savings, have not been redeployed or reinvested in other health care programs. There are gaping needs in the realm of health care, and we are dismayed to see that these cuts, if they are taken, will not be used to shore up other problems with other programs. The administration tells us that big program cuts are necessary because entitlement spending is growing at a fast clip. We know that. We understand that our population is aging. It's going to put unprecedented pressure on our health care entitlements. And we need to be looking for solutions, no question about it, not when the pressure comes to bear, but now. But as we accumulate debt, and the budget before us will accumulate $900 billion in additional statutory debt over the next 2 years, as we stack this debt on top of debt, we are adding to something called debt service obligations, leaving a legacy for years to come of debt service, interest on the national debt that has to be paid, which by the end of the budget period time frame we're talking about, 2012, the target year for balancing the budget, interest on the national debt by our calculation, by CBO's calculation, will be $285 billion, a substantial sum of money. As a consequence, these are dollars that are squeezed out of the budget that could otherwise be used for Medicare, Medicaid, or children's health insurance, or Social Security. Federal health care spending does not exist in a vacuum. We all know that. And one of the problems with reining in the growing cost of Medicare and Medicaid and our health care entitlements generally is that they're all a subset of the cost of health care delivery in our economy as a whole. This administration understands that. We understand it. And what we need to be about and looking for, among other things, are holistic solutions and not nickel and dime, case by case, piece by piece solutions. In that connection, we are concerned. We want to hear more about the administration's proposal to remove the manner in which employer-provided health insurance is now extended to their employees such that it is deductible by the employer and excluded from income by the employee. And in its place will be a standard deduction of $15,000 for a family. Raises lots of questions that we'd like to raise with you today so we can get a clarification of that and a better understanding of whether this is the route to a solution or just opening Pandora's box with lots of more problems to come from it. So we have much to talk about, and we're glad to hear your testimony first and then put some questions to you about these vital issues, vital to us as we put a budget together and vital even more to the American people.